It is well known that diseases like diabetes, high blood pressure, and other illnesses may restrict blood flow, which can lead to impotence and erectile dysfunction. This is why Enhance was formulated to meet these challenging health problems, which can reduce your ability to perform. If you're having problems maintaining your manhood, then reclaim your manhood today with Enhance. Enhance increases your energy level, boosts your stamina, and increases your endurance.
You can get your Enhance at Southwell VA4, Restorer Pharmacy Soufre, Knights Med Miku, Lay By Bar The Morn, Dexter's Place Jeremy Street Castries, Citygate Bar The City opposite the market, Plants Place Denry Highway, Arlette Supermarket Soufre, The Release Stress Bar Labrie Highway, Cool Joint Bar Victoria Schwazel, Prios Bus Stop 22, next to the Moshi Bus Stop opposite the Grosile Bus Stop. Prios Bar and Grill in Corinth, Grosile.
Enhance, the best a man can get.
Hi, I'm Jade, and my role at the St. Jude Hospital Reconstruction Project is to communicate with you, the public, exactly what is going on at each stage of the rehabilitation process at St. Jude. Now, we know that there have been many questions, and I'm here today to answer some of them. If you do not follow PHI, which is Public Health Insider, every Wednesday, please do so. We are on every Wednesday from 9:30 a.m. to 10 a.m. on NBC Television and Real FM. Now, let's get to those questions.
What was the signing ceremony about?
The government of St. Lucia and the Saudi Fund for Development engaged in a signing ceremony for two contracts for the completion of the St. Jude Hospital Reconstruction Project on September 13, 2024. Now, one contract is for the supervision of works and the other is for the completion of the hospital.
We do have many updates, as I
Does
had
that
mentioned.
mean the project hasn't commenced yet?
Is a photo update.
The St. Jude Hospital Reconstruction Project commenced on November 1st, 2022.
As you know,
now, currently there are 4 buildings that are approximately 75% complete. These are the physiotherapy building,
and as you saw last year on the 1st of July, it would have been the
dialysis building,
and child health services under UHC. Our director, Dr. Alicia Eugene Ford, has spearheaded the UHC
West
project
Wing,
and the
which
UHC
comprises
unit at
the
large,
kitchen,
and there has been a lot of
cafeteria,
work that has
and
gone
admin
on
unit
in
upstairs.
UHC. We're going to touch on all of it, but let's take a look at that slideshow and
power,
then have a discussion.
laundry, and maintenance.
A celebration to last throughout the years. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now. Celebration. Let's all celebrate and have a good time. Celebration.
Okay, so there we have it. That was just a quick peek
We want to know more about the contract. Can you tell us how the money is being spent?
Here is a breakdown on the last contract payments on the St. Jude Hospital Reconstruction project, which occurred on the 13th of September 2020.
What has transpired during the month, and then we compile that into a news style and deliver it to you, our viewing and listening audience. So we're going to head straight on to that. You would have seen in this video what has happened between September and October for UHC and what is to come as well. When we return, I will give you an update as to what has happened within the past week, and later on in the show you will be hearing from one of our facilitators from a key workshop that took place just last week.
Welcome to the Universal Health Coverage Monthly Newsletter. Here you will find out everything that has happened and is happening at the UHC unit at the Ministry of Health, Wellness and Elderly Affairs. I am Jade Brown, the communications specialist attached to the unit. Let's begin. Site visits continue at facilities that work together to conduct pap smears using liquid-based cytology. This has happened at the Miku Wellness Center. Nurse Persia Ajuda visited the Public Health Insider Show, PHI, to speak on breastfeeding, facts, tips and tricks to help new mothers with their newborns. The show was an informative one. Let's take in some of the excerpts. Site visits continued with the review of operations related to cervical cancer screening and HPV testing at the Laboratory Services and Consultation Limited at Tapio Hospital. Our project officer attached to Universal Health Coverage, Mr. Josue Prevelis, usually conducts these visits. He ensures that all UHC programs are running smoothly.
The purpose of this site visit helps us understand the operation in the workflow of laboratory services in processing pap smear on the UHC, in collecting the samples at all wellness centers around the island to label which one requires cytology or HPV testing, to later on we distribute the result at all wellness centers where the test was requested. As a unit under Ministry of Health, we ensure that the clients receive the quality of service as we promised them.
Now, cervical cancer screening and HPV testing was launched in August of 2024 under UHC. Using liquid-based cytology, it is also being offered at St. Lucia Planned Parenthood Association. Now, on August 29th, discussions on the final version of the UHC white paper continued. The white paper serves as a guide to develop, implement, improve, and contribute towards St. Lucia's healthcare reform. It will also ensure that UHC is seen as a collaborative effort by stakeholders from the public and private sectors, and everyone has ownership to accelerating progress towards attaining UHC in St. Lucia. On September 4th, planning meetings for prostate cancer screening at the primary healthcare facilities continue. Now, prostate cancer screening will be the next service introduced or launched under UHC. So far, we've seen maternal and child health services and as well cervical cancer screening and HPV screening as part of UHC. So the next phase of UHC will be prostate cancer screening. Health financing is a basic yet integral function of health systems that can enable progress towards universal health coverage by improving service delivery and financial protection. Adequately designed and implemented health financing policies will assist in addressing issues such as lack of access to care and increased out-of-pocket expenditures on health. On September 5th, the Ministry held another stakeholders consultation on health financing. Participants are from the Ministry of Health, sister ministries under the public sector and the private sector. The objectives of the consultation are 1. Raising the profile of health as a national policy priority, 2. Generating awareness on the implementation of UHC, 3. Sharing of the results of some technical work that has been done under UHC, 4. Sharing of some proposals in respect of health financing, 5. Obtaining feedback and perspectives from stakeholders on health and health financing.
We sought to host a broad stakeholder consultation, which included our partner agencies within the public service, as well as our support agencies of the World Bank Financing Agency, as well as other supporting agencies and groups to assist us in charting the way forward with our health financing reforms, and more specifically to look at options for financing of UHC going forward into the future. It was a very interactive session. We received several presentations that would have charted the way forward and provided us with meaningful options. And as we continue our progress today, we are hoping to continue the consultations, have enlightening discussions, and to really review and analyze the options which have been presented to us today.
The government of St. Lucia is committed to the implementation of universal health coverage for its citizens. The objectives being the reduction in out-of-pocket expenditure. We know that health expenditures are in fact a burden on our populace. We know that in St. Lucia about half of our total expenditure is funded by individuals out of pocket, the other half coming out of government. What we're discussing here today is in terms of how we can implement a predictable and sustainable health financing system. It's a complex matter. It involves significant sums. There are risks involved. Certainly, if the system is not sustainable, then you could have discontinuity in the provision of health services. At worst, you could have even result in some fiscal instability, which can throw the entire fiscal system off track.
Now that brings us to the end of the Universal Health Coverage UHC monthly newsletter. I hope that you learned a bit more about what's happening at UHC. Do tune in again at the end of this month for another installment. I'm Jade Brown. Good day. So that was our UHC newsletter. We will be seeing one newsletter. Hi, I'm Jade, and my role at the St. Jude Hospital Reconstruction project is to communicate with you, the public, exactly what is going on at each stage of the rehabilitation process at St. Jude. Now, we know that there have been many questions, and I'm here today to answer some of them. If you do not follow PHI, which is Public Health Insider, every Wednesday, please do so. We are on every Wednesday from 9:30 a.m. to 10 a.m. on NBC Television and Real FM. Now, let's get to those questions.
Or you can also
What was the signing ceremony about?
The government of St. Lucia and the Saudi Fund for Development engaged in a signing ceremony for 2 contracts for the completion of the St. Jude Hospital Reconstruction project on September 13, 2024. Now, one contract is for the supervision of works and the other is for the completion of
but
the
UHC
hospital.
encompasses so much more.
Does that mean the project hasn't commenced yet?
The St. Jude Hospital Reconstruction project commenced on November 1st, 2022. Now, currently there are 4 buildings that are approximately 75% complete. These are the physiotherapy building,
have access to quality health without financial hardship.
dialysis
So the government
building,
of St. Lucia saw the need to introduce a program where the people of St. Lucia can
West
access
Wing,
care
which
for
comprises
those illnesses
the
that
kitchen,
affect the
cafeteria,
majority of the
and
population,
admin unit
at
upstairs,
little to no financial cost on the client. And that is extremely
power,
important
laundry,
because that impacts
and
the health of the
maintenance.
nation, that impacts families, it impacts the workforce. So it is a
We
measure
want to
that is
know
taken
more
that
about the
will
contract.
reap benefits
Can you tell us how the
in
money is
years
being
to come,
spent?
immediately?
There
and
is a
in years to
breakdown on
come.
the last
A
contract
few weeks ago,
payments
you would have
on the
seen
St.
one of
Jude
our
Hospital
colleagues come on the
Reconstruction
show,
project,
and they
which occurred
indicated
on the
that over
13th of September
1,000 women
2024.
have access
The East Wing,
the maternal and child
$10.7
health
million.
services, and that number is climbing
Surgical wing,
every single day
$9.7 million.
because there are clinics
Medical
at the
equipment,
47
kitchen and
wellness
laundry
centers,
equipment and furniture,
for maternal and child health
$8.5 million.
services every day of the week.
External works
there are
and electrical
specific
works,
days, as we have
$15.3
indicated,
million.
as with maternal
Climate
and child
smart
health,
proofing
cervical
and
cancer,
rainwater
and
harvesting,
those
6.3 million.
packages that will be available
Volunteer
under UC
ambulance
to come.
biomedical warehouse
There
buildings,
are specific
4.4
days that you
million.
can access the care at
South
the wellness
wing
center. So it
ceiling
is very
and preservation,
important to
1
build,
million.
establish that
Contingencies
relationship
and
with your
1
wellness
year
center,
maintenance
with
and
your healthcare
supplies,
providers,
7.9
so that you have the
million.
information that you
The
need.
total
I
for
believe
that
that
contract
sometime
is
last week
$63.8
we did receive a
million.
call where somebody was a bit
There is also
confused
a
as to
supervision
the date
contract
in
which stands
they
at
can access the care
$2.9
for
million.
cervical
In
cancer
addition,
screening.
$8 million
I
has
think that it
been
was
set
indicated to
aside
them
for the
that,
George Odlin
that service
Stadium
was not
rehabilitation.
available at the
These
wellness
are
center,
answers
but,
to some
we
of the
refuted
questions
that,
that
and
you've
I'd like to
posted
categorically
to our
state
Facebook
on this
pages,
show that yes,
Instagram
cervical
pages,
cancer
as well
screening
as
is
our show
available
every
at
Wednesday
single wellness
on
center
Real
St.
FM
Lucia.
and
If it
NBC
isn't
Television. If you
available
do
at a
have
wellness
more
center, it's
questions
because the
about
wellness
this project,
center is
do
closed or
interact with us,
temporarily
engage with
closed
us on our
at
social
that
media
time.
platforms,
But
and
there
look
is
out for
a,
another
there is an
Q&A
ad out
with
on
yours
about
truly.
9 or 10 media houses currently. We also have a very active social media page. We have our healthcare practitioners in the communities because not everybody follows social media. So if you do not follow traditional or social media, digital media, you can consume that information by visiting your wellness center. It is very important to call your wellness center before venturing to down to the wellness center to access the care. It is tremendously important. When you do go to the wellness center, please present your ID. It doesn't matter which service you are accessing, walk with your ID so that you can then be entered into the database. When you are entered into the database, whether you access care through the wellness center or through another healthcare facility, that healthcare practitioner can then tap in to the database and get your medical history. It is so incredibly important and it makes things a lot easier. Just last week, Monday, I believe, the government of China on Taiwan, the Republic of China on Taiwan actually launched the iSwitch app. So you will be seeing advancements every day. The government of St. Lucia is launching new advancements in healthcare. While there may be a strain on the main hospitals in St. Lucia, they are creating avenues for you to access care at your local wellness center, so that the strain upon the main hospitals is lessened, and that people can receive the care that they so desperately need. As I mentioned earlier, maternal and child health services 1. Cervical cancer screening also was launched in August of this year. With cervical cancer screening, you can access screenings for, you can have your pap smears as well as HPV screening. I'm going to pull up some information on the cervical cancer and HPV screening so that I can share with you right now. Those of you who have not received that information, we have it here today. Let me just pull that up for you, because there are so many strains of HPV, and with the new method there are many opportunities. Unless Dravid can pull that up for me, the graphics. So yes, so we will get that graphic and share that with you this morning. We'll share it again on our Facebook page so that you can as well have that information. You can download it as well. We have the information in terms of the wellness centers and the clinic days and the contact numbers for these wellness centers, so that you can book your appointment to go in and get that all important pap smear done. The reason why maternal and child health and cervical cancer screening are the first two, it is because maternal and child health is one area in which people needed that assistance, and they seek that care. And as Dr. Eugene has mentioned countless times before, there have been many occasions where women go full term without having a single ultrasound done or a single blood work done. And when they go to the hospital to deliver their baby, they don't have that medical history, and that can have so many negative repercussions for mom and the baby as well. So the government of St. Lucia saw it fitting to launch with maternal and child health. Now we are on cervical cancer and HPV screening. Dravid, we ready? Cervical cancer and HPV screening. And then, with this screening, they have noticed that cervical cancer is one of the main killers in St. Lucia. It has claimed so many lives in one way or another. And HPV is preventable with the right interventions by healthcare. So this is all part and parcel of what UHC really is. The preventive, palliative care as well is very important, and we're going to be touching on that again. I do know that we might be having something on screen right now, so those of you who are watching on Facebook, on our Facebook pages, and also on NBC television, you would have seen the Did You Know? You would have seen the quick facts on cervical cancer and HPV screening, so you can get that information right there. Those of you who are not able to take a screenshot, we will have it on our Facebook page, so you can download it as well. We also have the various wellness centers, the clinic days, the numbers, so we're making it very easy for St. Lucians to access that care. Look at the time, it's already 9:52, and we do need to touch on the all-important St. Jude Hospital Reconstruction project. We have an update, and here that is. When we return, we will take a quick break, and then we will welcome Dr. Owen Gabriel, who will be calling into the program to discuss the palliative care workshop, a 2-day workshop which occurred last week.
Operating here at St. Jude Hospital has been fraught with challenges. However, we remain steadfast in our commitment to provide care that is of high quality, care that is safe, care that is efficient. And to that end, whilst we eagerly anticipate our move to the OJ site, we do recognize that it takes continuous work to ensure that we provide care that we aim to provide, care which is of good quality. Therefore, we have embarked on a number of improvements to some of our services. Lots of spaces have been renovated to ensure that the environment is one which is conducive to practicing safely and efficiently. So we have renovated our radiology department, and we are looking to expand our services in that realm as well. our operative suites did get some work as well. We renovated one of the operating rooms, as well as did over our recovery area and our daycare area, and expanded the capacity to do endoscopies by renovating a space specifically for endoscopies and local cases. On the medical ward, we realized that there was some need for work on that department, so we did some renovations to that space. So patrons on the medical ward would have a space which is a lot more comfortable presently. We also want to take this opportunity to say a sincere, heartfelt thank you to all our clients, all our patrons, for their patience, for their support, for their understanding over the years, and particularly during the past few weeks. We appreciate that it has been challenging for you being able to access these services, but rest assured that we are committed to continually improving our services, not just here, but also for when we move to our new site.
Okay, so that was a slight change of plans that you saw there. That was an update of the
Hi, I'm Jade,
Hospital,
and my
at
role at the
Tottenham
St. Jude
Stadium.
Hospital Reconstruction
It was
project
important
is to
for us to head
communicate
down
with
there
you, the public,
and
exactly
get
what
that
is going on
information
at
first to
each
hand to share
stage
with
of
you
the
while we
rehabilitation
provide
process
communication
at
services
St.
for
Jude.
the St. Jude Hospital
Now, we
Reconstruction
know that there have
project.
been many
It is
questions,
important to
and I'm here today
bridge
to
that
answer
gap
some
between
of
the
them.
project
If you
and
do
the
not follow
hospital.
PHI, which is
Yes,
Public
the
Health
government of
Insider,
St. Lucia
every
is
Wednesday,
working
please do so.
assiduously
We are
to
on every Wednesday from
opening of the
9:30
St.
a.m.
Jude
to 10
Hospital
p.m. on
at the
MBC
OG
Television
site.
and Real
However,
FM.
Now,
Let's get to
it
those
is important
questions.
to keep the clients.
What was the signing ceremony about?
The patients.
The government of St. Lucia and the Saudi Fund for Development engaged in a signing ceremony for 2 contracts for the completion of the St. Jude Hospital Reconstruction project on September 13, 2024. Now, one contract is for the supervision of works and the other is for the completion of the hospital.
As you saw,
Does that mean the project hasn't commenced yet?
You also saw the business and
The St. Jude Hospital Reconstruction project commenced on November 1st, 2022. Now, currently there are 4 buildings that are approximately 75% complete. These are the physiotherapy building,
the goal is for the St. Jude Hospital administering care to
dialysis
and allow
building,
people to feel more comfortable. We knew from the government of St. Lucia they did announce the injection of cash.
West Wing, which comprises the kitchen, cafeteria, and admin unit upstairs,
and the reason for that was to upgrade the facility in a sense. It was
power,
also to upgrade,
laundry,
the
and
equipment,
maintenance.
upgrade the rooms, and just provide and as well.
We
there
want to
will
know
be
more about the
more
contract.
beds
Can you tell us how the
added,
money is being spent?
at the
Here is a
hospital.
breakdown on
So,
the last
there
contract
are many,
payments
many
on the St.
individuals
Jude
who
Hospital
access care. I believe
Reconstruction
that
project,
St. Jude Hospital
which occurred on the
provides care to over
13th of September
60,000
2024.
people in the south,
The East
the southern
Wing
belt of the island. So it was very important for the government of St. Lucia to give them a more comfortable environment. So now we move on to the St. Jude Hospital Reconstruction project at the OG site. You have our previous update right here. On Friday, we'll be heading down there as well. Dravid and I will be heading down there. We will have another update for you. There has been a lot of work done between what you are about to see and what you will see next week. Next week, we will focus on St. Jude solely, but it is important to give you regular updates as to what is transpiring at St. Jude. So let's head on to that video.
Hi, I'm Jade, and my role at the St. Jude Hospital Reconstruction Project is to communicate with you, the public, exactly what is going on at each stage of the rehabilitation process at St. Jude. Now, we know that there have been many questions, and I'm here today to answer some of them. If you do not follow PHI, which is Public Health Insider, every Wednesday, please do so. We are on every Wednesday from 9:30 a.m. to 10 a.m. on NBC Television and Real FM. Now, let's get to those questions.
What was the signing ceremony about?
The government of St. Lucia and the Saudi Fund for Development engaged in a signing ceremony for 2 contracts for the completion of the St. Jude Hospital Reconstruction Project on September 13, 2024. Now, one contract is for the supervision of works and the other is for the completion of the hospital.
Does that mean the project hasn't commenced yet?
The St. Jude Hospital Reconstruction Project commenced on November 1st, 2022. Now, currently there are 4 buildings that are approximately 75% complete. These are the physiotherapy building, dialysis building, West Wing, which comprises the kitchen, cafeteria and admin unit upstairs, power, laundry and maintenance.
We want to know more about the contract. Can you tell us how the money is being spent?
Here is a breakdown on the last contract payments on the St. Jude Hospital Reconstruction Project, which occurred on the 13th of September 2024. The East Wing, $10.7 million. Surgical Wing, $9.7 million. Medical equipment, kitchen and laundry equipment and furniture, $8.5 million. External works and electrical works, $15.3 million. Climate smart proofing and rainwater harvesting, $6.3 million. Volunteer ambulance biomedical warehouse buildings, $4.4 million. South wing ceiling and preservation, $1 million. Contingencies and 1-year maintenance and supplies, $7.9 million. The total for that contract is $63.8 million. There is also a supervision contract which stands at $2.9 million. In addition, $8 million has been set aside for the George Odlum Stadium rehabilitation. These are answers to some of the questions that you've posted to our Facebook pages, Instagram pages, as well as our show every Wednesday on Real FM and NBC Television. If you do have more questions about this project, do interact with us, engage with us on our social media platforms, and look out for another Q&A with yours truly.
So many updates today on both UHC and St. Jude. But now we head on back to UHC. As we wrap up the show, we'll be hearing from Dr. Owen Gabriel, who was a facilitator at our palliative care workshop. He is on the line with us this morning. Good morning, Dr. Gabriel.
Good morning, Jade, and thank you and your listeners and viewers for having us on today.
Thank you for joining us. Dr. Gabriel, can you give our listeners and our viewers just a brief overview of what entailed with the palliative care workshop and what you had hoped to achieve and what was achieved during those 2 days?
Okay, thank you. Absolutely. I'd be happy to do so. Not very many people are familiar with the concept of palliative care. And, palliative care is considered a human right in the world. And in essence, what we know is that palliative care is the comprehensive assessment of a patient to alleviate suffering and pain through the early identification of these problems that they may have. But going beyond the physical, going towards the psychosocial and the spiritual problems. Ultimately, palliative care is the active improvement in the quality of life and relief of suffering for patients with incurable disease. We believe that palliative care is to be considered in reality a poverty reduction strategy. And you may ask, well, how is that? What we taught our participants were processes and methods to implement palliative care in the context of community health as well as in-hospital health services. So under universal health coverage, this will become an opportunity for us to reduce the grievances that our people have with our healthcare services. One with access to care, and the other with the availability of the services in our healthcare facilities. So in essence, what we have taught people to do is to reduce the time it takes to get a specialist to see about a particular problem when it comes to pain and suffering, as well as access to the medications in the communities through our pharmacies, and access to our dietitians, our social workers, and so on, all of whom were represented in that working group that the participants who were part of that working group in our workshop. So we have created a network, and ultimately this is the goal, so that we create a network of actors in primary care setting who can come together to make the patient's journey through the healthcare system something that is seamless almost, and with as least suffering and pain as possible, considering that suffering and pain is not just the physical suffering. It's the emotional suffering when you can't get to see your doctor, or you can't get a medication, or it's too costly, or there are other family-related factors affecting the way you access care. So we think that this will solve or help reduce the challenges and obstacles that people face in our society.
Okay. Thank you, Dr. Gabriel, for that insight into the palliative care and the palliative care workshop. I do know that Dr. Eugene and the unit, we are planning to have many more workshops in the future, so that more nurses and more healthcare providers can gain that insight that you delivered to them. So thank you for facilitating and also for participating in this show.
Thank you so much. I want to add that there was a previous workshop for carers,
right,
conducted a couple of months ago. So we didn't just look at the actual healthcare professionals, but we also looked at persons who are in direct contact at homes, at the elderly homes, in persons' private homes, attending to patients who may have incurable diseases or life-threatening diseases or long-term illnesses that need that kind of attention. to access it through our palliative care network. So it's a movement that we hope to inaugurate in St. Lucia in our different health centers and health facilities.
Okay, fantastic. Thanks for that, Doc. And with that, we come to the end of PHI for today. Do join us again next week as we have an update from the St. Jude Hospital Reconstruction Project. We will also be launching another newsletter for the period of October to November, both on St. Jude and UHC. So you would have all that information then. We look forward to seeing you once again next week, Wednesday, right here on NBC Television and Real FM.